If you're watching this, you are looking for hard data. We are going to bypass the emotional weight of a diagnosis today and look directly at the peer-reviewed clinical evidence regarding vitamin D3 and cancer outcomes. Before we review the trials, a necessary note. This is a factual evidence summary, not medical advice. You should make zero changes to your routine without consulting your oncology team. The core biological issue at play is depletion. Standard oncology therapies, combined with the systemic inflammation caused by cancer itself, actively drain the body's natural reserves of vitamin D3. Because these treatments drain those reserves, vitamin D3 is a critical, trackable biological marker essential for your baseline defense. Let's examine the data on timing. A major clinical study reviewed national patient records to track specific breast cancer outcomes relative to vitamin D3 supplementation. This chart shows the mortality rate for the study's general user cohort. For patients who used vitamin D3 supplements at any point, the data revealed a baseline 20% reduction in breast cancer-specific mortality. But the researchers isolated a crucial variable. They separated out the patients who initiated their supplementation early, specifically within the first 6 months of their diagnoses. In the early initiation group, the mortality risk reduction reached 49%. Intervening early with measured vitamin D3 repletion alters the long-term survival trajectory for breast cancer patients. The PROVIDENCE trial offers insight into advanced cases. This prospective study tracked patients undergoing immunotherapy treatments for cancers like melanoma, lung, and kidney cancer. The results indicate a specific clinical synergy. Systematic vitamin D3 repletion actively enhances the tumor-killing efficacy of the primary immunotherapy drugs. Patients who received this systematic repletion saw an average 45% reduction in the risk of death, yielding a hazard ratio of 0.55. They also demonstrated longer overall survival and an extended time to treatment failure. Alongside those survival metrics, the trial reported a secondary benefit. The supplemented group experienced significantly fewer severe immune-related adverse events, particularly a drop in thyroid toxicity. Systematic vitamin D3 repletion protects the body's systems while amplifying the effectiveness of the main therapy. We see a clear scaling effect in a global meta-analysis of nearly 8,000 prostate cancer records, which focused entirely on circulating vitamin D3 metabolites in the blood. This graph illustrates what researchers call a dose-dependent effect. By plotting serum vitamin D3 levels against mortality risk, we see a defense system that scales based on concentration. The math here is exact. For every 20 nanomoles per liter in serum vitamin D3, the data confirms a compounding 9% reduction in mortality risk. Reaching and sustaining those high-tier serum thresholds dictates the actual survival benefit, rendering arbitrary low doses insufficient. Whether looking at breast cancer, immunotherapy, or prostate cancer cohorts, the data points to the exact same conclusion. Vitamin D3 is a crucial, universally modifiable factor in patient outcomes. But you must ignore the internet hype cycle. Guessing dosages without knowing your actual baseline is ineffective and carries risk. Never, ever self-medicate. There is a precise clinical term you need to know. It is serum 25-hydroxyvitamin D. That is the specific blood marker required to establish your biological baseline. Your immediate next step is to take these specific trial findings directly to your oncologist and request a baseline blood draw for that marker. True empowerment comes from replacing internet guesswork with a precise, collaboratively monitored clinical repletion protocol.